In this video, we're talking about one of my favorite topics, blood pressure. In a few minutes, I'm going to tell you why blood pressure testing can be life-saving for your older cat. But first, we're going to talk a little bit about what causes high blood pressure in cats. High blood pressure can occur for two reasons. Either it is a complication of another underlying disease, and in the cat, the most common one is chronic kidney disease, or high blood pressure is what is known as idiopathic, which is just a fancy term that means that we do not know why the blood pressure is high. High blood pressure is a very common condition in older cats. Finding and treating high blood pressure is really important for a couple of reasons. One excellent reason is that it is very treatable. Sometimes treating the underlying condition is enough, and if we cannot treat the underlying condition, or if your cat has idiopathic high blood pressure, there is a tablet that can be given daily to control the high blood pressure, really similar to humans. Now, as cat owners, we all know that some cats can be really difficult to pill. So the great news is that there is also a cream that can be rubbed on the inner ear that does exactly the same thing without you having to tablet your cat. The other really important reason to find and treat high blood pressure are the very serious and severe consequences of having high blood pressure for your cat. The most common consequence is sudden detachment of the retina and bleeding within the eye. This happens because the small vessels at the back of the eye cannot cope with high pressure and they burst. Detachment of the retina may be partial, so your cat may retain some sight, but often cats are completely and suddenly blind because the entire retina detaches. If retinal detachment happens and you already have an elderly cat that is slowly going downhill and is now struggling to get around because they suddenly cannot see, what do you think happens? Often these cats are euthanized, and this is so heartbreaking because it is almost 100% preventable. And that is why blood pressure testing can be life-saving for older cats. There are other excellent reasons to test for and treat high blood pressure in cats. It can cause stroke, it may also contribute to dementia, and it has a negative impact on heart and kidney function. Testing blood pressure in cats is super easy. It is really similar to humans. We use a small cuff that goes around the cat's leg or their tail, and this enables us to measure their blood pressure. Cats' retinas should also be checked because sometimes you can see changes on the retina that may be diagnostic of high blood pressure. Here we come to the only tricky bit with blood pressure. While actually testing blood pressure is easy, interpreting the blood pressure readings that we get at the vet may be a little challenging. Most cats at the vet get stressed, and when they are stressed, their blood pressure goes up. So a high blood pressure reading at the vet means that either your cat really does have high blood pressure or that they are stressed. There are lots of things that you can do to help make sure your cat's blood pressure reading is accurate. At the vet, you need to give your cat time to come out of the carrier, get used to the new surroundings, and calm down after the car journey. It is also really important that when your cat's blood pressure is measured, your cat should never be taken from you to some busy, noisy room elsewhere in the vet practice. In those circumstances, it is highly likely that your cat's blood pressure will be high. I also recommend that you make an appointment specifically for blood pressure testing. The time that your cat needs to acclimatize to the room, together with taking the readings, can take up to 15 minutes. Most vet practices allocate about this amount of time to a single appointment. Therefore, if you have an appointment for a vaccine or for some other treatment, asking your vet to do blood pressure testing at the end of your appointment is not the best time, as your allocated time will already have been used. Adding blood pressure testing to the end of the appointment will mean that your vet will need to rush to not keep their next appointment waiting. And these are not ideal conditions and can lead to a high blood pressure reading. That is why I recommend that you make an appointment specifically for blood pressure testing. House visits are also great for blood pressure measurements if your vet offers this service. And if your vet finds that your cat's blood pressure has been high and has been in a calm environment with you present, it may be worth rechecking it on another day to make sure that your cat was not hiding that they were stressed. Treating blood pressure is for life, so you want to make absolutely sure that the reading accurately represents your cat's true blood pressure. All cats over the age of 9 should have their blood pressure checked at least once a year, and more frequently as your cat ages. Additionally, all cats with chronic kidney disease should also have their blood pressure checked once or twice a year. That is it. That is why blood pressure testing is so important and even life-saving for older cats. I have more resources on my website, allcats.co.uk, and if you have topics that you would like to see a video on, please let me know and I will be happy to make one for you. See you in the next video.